Hi, thanks for joining me. I'm Christopher Sovereign, Director of Sovereign Seminars, and I'm here to introduce the Low Back and Sciatica Pain Assessment and Treatment of Soft Tissue Injuries, which is a Ben Benjamin medical massage course. And so I'll explain those, but first let's talk about low back pain for a moment. Now, contrary to what the public typically thinks, most low back pain is not from the discs, and this is from research from the physicians. And most sciatica, different than most massage therapists think, is not from the piriformis, in my experience. But in this course, we will teach you a piriformis test. That's a standard physical therapy, physical medicine test for the piriformis. And it'll show you that most of the time it's not coming from the piriformis. Does sometimes, most of the time, in my experience, it's not. So this class will cover serious solutions to the most common causes of low back pain. So you'll be able to walk in with confidence and help people almost immediately get some relief, and usually with multiple treatments, quite a bit of relief in solving their low back and sciatica pain problems. Now, how is this course different? Well, there are three main ways that this is different. Let's look at them one at a time. Now, the first is assessment testing. So we're actually going to put a physical stress on different tissues to find out their relative health. This will give us excellent information on guiding our treatment, so we'll go right to the correct tissues. Now, this is different than, say, the standard NMT measurements, like measuring the pelvis, measuring the skeleton. Those are good sources of information, but you can understand that they're not actually testing the tissue itself. So it's a measurement, but it's not directly specific. If I wanted to do a passive test on this tissue, what I would do is I would put a slight amount of physical stress on it. So now I'm being very specific with the tissues here, and I'll get very specific information back. So measurements are wonderful, and I do use those, but this is going to go beyond mere measurements into actually testing specific structures. Very important tool. The second thing that makes this course different is that we're going to be dealing with injuries and bad repair jobs. So, in most massage, the focus is on muscles and on tight muscles. Now, tight muscles are not technically injured tissue, they're just tight. Injured tissue, by my favorite definition, is when the strength of the tissue is overcome. So microscopically, there's little tears in the fibers, and so there's something that needs to be repaired. You can understand that in a tight muscle, it doesn't need to be repaired because there's nothing broken. It may be a misfunctioning system at the moment, but there's nothing broken that the body is going to send fibroblast cells to repair. In this course, we're going to be working with injured tissue to help the body heal better, whether it's a fresh injury and it's healing in its original form, or whether it's a bad repair job that can easily be helped with this particular style of work. I've worked with 5, 10, 20, 50-year-old injuries and gotten excellent results using this work, because it's not that it's a current injury, it's that it's a bad repair job of an injury, and we can go in and help the body heal much better. We're going to be working with gristle. So what do I mean by gristle? Well, in the lumbopelvic area, it's mostly going to be ligaments, but gristle, by my definition, is ligaments, tendons, some denser fascia, retinaculums, expansions, things like that. So gristle is tough, sinewy, avascular tissue that needs help in healing, and it doesn't relax So it's not tissue that you can use normal massage techniques with. They need different techniques because of their unique composition and nature. We're going to be focusing for 3 days, and we're not going to be focusing on the muscles. So if all of your low back training is in muscles, this class will be excellent for you because this will take you into another area of soft tissue that you're currently missing, and so it'll be a fabulous addition to your current work. So there you have your 3 areas that make this course unique. Assessment tests that we're going to be dealing with injuries and also gristle. So this should be an excellent contribution to what you're already doing, and you will get specific direct results. This class is specifically for people who are working with people with pain in the low back area, pain and sciatica, or want to work with that kind of population. If you love doing relaxation massage, then this will not be the course for you. Now, in this area, it's my experience that it's not the QL, it's not the piriformis, and sometimes it's the psoas, but many times it's not. It's the gristly tissue. That's what we're going to be focusing on. That's what I'm going to help raise your expertise in. Now, I do have a little quiz. Do you need this class? Well, if you already know the answers to these quiz questions, then you probably don't need this class. But if you don't know the answers to these, you might consider it. So number 1, with the supraspinous ligament, what is the direction of the pain referral? From the supraspinous ligament, what's the direction of referral? Number 2, of the ligaments in the lumbopelvic area, what is the one that, if there's going to be referral to the anterior, is the most common ligament to be doing that anterior referral? And number 3, what's the direct anatomical connection between whiplash and low back pain? You're welcome to go to sovereignseminars@gmail.com and ask for the answers to these questions. Be happy to answer, or you can give us a call and I'll give you those. All right, thank you so much for your time. I know that if you're serious about helping people that have serious low back pain, in more than 80% of the cases, you'll be able to help them with the work in this course. Excellent work for people who want to be working at the highest level. Please get in touch with us. Thank you so much for your time.